Dear colleagues, welcome to day 2 of the OncoAlert Roundup for ASCO 25. Today, I'll share some of my picks for the most exciting trials presented on day 2 of ASCO 2025. And for a deeper dive to these studies and more, I encourage you to sign up for our newsletter at www.oncoalert360.com or through the link. Let's start with the first trial, Vepdegestrant, a PROTAC estrogen receptor degrader studied in advanced breast cancer. This phase 3 trial focused on patients with ER-positive, HER2-negative disease who had already been treated with CDK4/6 inhibitors and endocrine therapy. Vepdegestrant, an oral drug that degrades the estrogen receptor via the ubiquitin proteasome system, was compared to Fulvestrant, the current standard given by injection. Among patients with ESR1 mutations, Vepdegestrant showed a significant improvement in progression-free survival. 5 months compared to just over 2 months with Fulvestrant, with a hazard ratio of 0.58, which is quite impressive. However, when looking at all patients in the trial, the overall benefit didn't reach statistical significance. There were more grade 3 or higher side effects with Vepdegestrant, but treatment discontinuation remained low in both groups. These results highlight Vepdegestrant's potential as a targeted option, especially for those with ESR1 mutated tumors. Next up is the ASCENT-04 or KEYNOTE-D19 trial investigating sacituzumab govitecan combined with pembrolizumab in previously untreated PD-L1 positive advanced triple-negative breast cancer. This phase 3 study demonstrated that the antibody-drug conjugate sacituzumab govitecan plus pembrolizumab significantly improved progression-free survival and the durability of response compared to the chemotherapy and pembrolizumab. The safety profile was manageable, and early data also suggests a possible overall survival benefit. These encouraging results position the combination as a promising new standard of care for this challenging breast cancer subtype. Moving on to the third trial, focusing on novel CAR T therapy called Satri-cel, targeting Claudin18.2 in advanced gastric and gastroesophageal junction cancer. In this phase 2 randomized study of heavily pretreated patients, Satri-cel significantly improved progression-free survival 3.25 months versus 1.77 months, with a hazard ratio of 0.37 and a highly significant p-value. There was also a trend towards longer overall survival. The therapy was well tolerated, and even patients who crossed over to receive Satri-cel experienced improved outcomes. This data supports Satri-cel as a promising new treatment option for CDLN18.2 positive gastric cancers. Our final highlight comes from the CASSANDRA phase 3 trial in pancreatic ductal adenocarcinoma. Here, patients with resectable or borderline resectable disease were randomized to preoperative chemotherapy with either modified FOLFIRINOX or PAXG regimen. After nearly 2 years of follow-up, PAXG significantly improved 3-year event-free survival compared to modified FOLFIRINOX, 30% versus 14%, with a hazard ratio of 0.66. PAXG also showed better disease control, a greater reduction in CA19-9 tumor markers, and more favorable pathological downstaging, though it was associated with higher rates of grade 3 or 4 neutropenia. These findings suggest that PAXG could become a new neoadjuvant standard for these patients. And there you have it, folks, my top picks from day 2 of ASCO 2025. Thank you for your continued support, and I look forward to bringing you more updates for day 3. Stay tuned.